Thank you for joining us today. We are having our third call in the COVID vaccine series. This one is called COVID Controversies. Today, we're going to be talking about the variants, the J&J pause, the reinfection. What do you do once you're vaccinated? Side effects, of course. We decided to kind of change the format a little because we feel like most people know what COVID is, but feel free to ask any and all questions. Of course, we have Ty Redman, my wonderful cousin, who is actually hosting the call with Capital Prep Harlem. We have Dr. Ian Moore, who is Chief of Pathogenesis at the National Institute of Health. He ran the uh, Moderna safety and efficacy trials. We have Dr. Ogechika Alozie, one of the top infectious disease physicians who has a clinic in El Paso and used to be the chief medical officer at a HCA facility during the COVID blow up down there. And we just want to make sure that we are providing you all of the right information so that you can leave this call with the clinical confidence to make whatever decision you've made or stand firm in whatever decision you've made. We also have a representative, Lauren, from the YWCA. They're actually the people who put our flyer together and has helped support us in um, promoting the different talks throughout the ever since December. So I don't know if Lauren is here, if she wanted to say a few words. Lauren, are you in? Is Lauren?
Yes, I'm
Okay.
in.
All right.
I'm in, and thank you. This has been a fabulous partnership. Just a little bit about the YWCA. We operate as a network of 300 YWCAs. We're part of the YWCA USA. And I'm just going to send you to our website because we do so much that I don't want to spend a lot of time about what we do. So our website is www.ywcachicago.org. And I just want to encourage people to really, first of all, I want to thank you for your Saturday, because I know Saturdays you could be doing a whole lot of other things, and you decided to join this conversation. So get your coffee, tea, whatever your favorite beverage is, paper and pencil, because your questions are important, and these doctors got the answer. And if they don't have the answer, they know where to go get it. And that's it. Just want to thank you for this opportunity and this real partnership.
Thank you, Lauren. And again, thank you and your team for your assistance. And I just want to kind of jump in. I do want to make sure that everyone knows there's no such thing as a stupid question. These physicians can answer any and all of your questions, whether it's scientific, whether it's history, because based on hesitancy, vaccine hesitancy, or it's clinical. So please feel free to ask your questions. If you don't feel comfortable coming online asking your questions, just go ahead and DM me and myself or Ty or Dr. Moore or Dr. Alozie, and we will get your questions asked. Okay. So I'm going to turn it over to Dr. Ogechika Alozie. He's going to start the presentation, and sit back, relax, and enjoy the forum.
Thank you.
It sounded like an Escape song from the 90s for a second.
We should have played Escape.
All right, good morning, everybody. For those of you that have been here before, welcome back. For those of you that are new to this presentation, thanks for taking part of your Saturday. Myself and Dr. Moore are going to sort of tag team this and go from there. I'm going to dive right in. And when Ms. Johnson says we changed up the format, well, we decided what we had done in the past was do a really granular look at what's a vaccine, where did it come from, why is it quick, why is it not? I think in April of 2021, it's a very different conversation, right? And so we're going to make this a lot more laid back, sort of like you would kick it at the barbershop and argue about sports and somebody's hair and somebody's car, maybe cryptocurrency. And so we're going to sort of take it like that. And so it's going to get really quickly into it. Where are we now? What are the vaccine controversies? And then barbershop time. We'll open it up to let people ask their questions. First things first, I think the important thing is, hey, coronavirus. And so I have somebody that's much more skilled than I am that can talk about the science of a coronavirus. So I'm just going to hand it over to Dr. Moore.
All right. Well, I appreciate it. Once again, on the same note, thank everybody for taking the time this Saturday morning. Hopefully you will walk away with a lot more information than you had when you started. Coronaviruses, I think we have heard to some degree what these viruses are right now. These are viruses that, for me, my background is I'm a veterinarian by training, but then I did a residency in pathology and I did a PhD in immunology and virology. And so all these things go together. For me, it makes a lot of sense because these viruses that we're talking about, most of them have been circulating in animal species for quite a while in nature. And so what happens is, you hear about how it affects us, and we're getting vaccines and everything, but then every now and then you hear something about an animal that was suspected to be in Wuhan, China, at some point in time at a market and all this kind of stuff. So the reality is that we have a very close reality and association with animals and nature, and so what happens is when these viruses sometimes mutate, they change, they jump from animal species over into people. When you have a jump from animals to humans, usually the outcome is extremely rough because we don't have any protection against that virus. So that's essentially what these coronaviruses are. Viruses that were circulating in animals, they mutate, jump into people. We don't have any protection. Now we have a global pandemic. And so, it's an RNA virus. And I want you to remember that. I want you to remember RNA virus because at some point in time, I'm going to talk about, I'll mention again why RNA viruses are important. It's just a classification. But what I will tell you is that RNA viruses, when they replicate, they're error prone. They make mistakes. And that's actually where we're getting all these variants from. So you keep hearing variant. I'm going to talk about variants at some point in time. You're going to hear variant over and over and over again. Variants are coming from these viruses replicating, making a mistake, and the mistake sometimes makes them stronger, or sometimes the mistake can make them weaker, and you don't hear about those. But the ones that are stronger, that replicate better, that transmit easier, those are the ones that we're hearing about. So I will discuss that at some point in time. Dr. Alozie will move through and we'll talk about variants. But we know what coronavirus is now. We know what COVID-19 is. And it's something that we need to take serious. And now we have 3 different tools that we can use to try to protect ourselves. And so this presentation will walk you through that. Please ask your questions. As Ms. Johnson said, there's no such thing as a silly question or stupid question. Ask it, and we'll try our best to answer. Dr. Alozie.
Absolutely, sir. And so again, as sort of Dr. Moore alluded to, vaccines are part of his lifeblood and what we're really here to talk about. I've used this slide before to talk about how 2020 was the year of the vaccine. And, it's kind of funny, and again, I'll throw it back to Dr. Moore, but it was interesting to me how creating the vaccine was almost the easy part, right? When we figured out the genetic sequence of COVID back in, I think, February of 2020, all the process that your labs and a host of other labs went through to get it through the FDA, that seems easy. The hard part, which should have been the easy part, which is getting these vaccines out, is now the hard part. And so what are your thoughts about that?
You're exactly right. And you look at the, I mean, for me in my lab, you're sitting in the middle of a pandemic, you see cases going up, you see numbers going up, and you're doing everything you can. You're going to work, but I'm still managing my staff and I'm staggering them because of course we have to do social distancing in the lab. You get all that stuff done and you go through this process, you get a vaccine to the FDA or to the FDA for authorization. And then but then for me, it wasn't terribly surprising. I knew that there was going to be hesitancy, especially in the Black community. And so I was preparing for that even when we were in the process of even submitting this information to FDA. I said, if this is going to FDA and getting ready to be approved or at least authorized, then I need to go ahead and start talking to people back home and anybody who I can talk to, because I did the same thing back when I was an influenza researcher. I knew flu vaccines were a place where people say, I don't need that, and now I think the script has completely flipped. People see the importance of vaccinations. It just depends on how deadly or how serious the pathogen we're talking about is. So, but yeah, so now the part that we're doing now, which is supposedly the hard part now, is to try to make sure that you understand what it is that you're taking and why you need to get it.
Absolutely, I appreciate that, man. And so to ask or to answer the question, where are we now in the United States? If you look at this graph, we're kind of flat, right? We've gone up, we've come down, we've gone up again. And for those of you who may wonder, well, we're getting all these vaccines out, what's going on? Well, here's the problem. In certain parts of the country, things continue to go up. In certain parts of the country, they're doing really good with getting vaccines. And so the net effect of that is a flattening of cases, right? I can dive in really quick here to some information, but I think if you look at the United States, I like to use the Financial Times because they do a great job. It'll show us a breakdown of the various states in the United States. You'll see that Michigan, everybody's been talking about, and we'll talk about Michigan when it comes to variants later, if my internet works properly. But Michigan has been the problem. They're starting to actually come back down now. Right, so let's see here. I'll actually use countries. So if you see here, and I put Curacao because that's where I am, but the United States is staying flat. The United Kingdom, that's way ahead of us in vaccines, is starting to come down. And I think that's an exciting part when you look at that. If I switch over, there we go. And this is the United States. So you can see Michigan coming down, New Jersey coming down, New York coming down, North Dakota and South Dakota coming down, California coming down from this steep track. I'll hide these lines so you can see it better. And you can see across the board, all these states are starting to come down. Again, there's some states in the country that are going up. And so that's what's causing this line that I referred to be flat. Diving into, well, what are we talking about? These are vaccines, right? There's a host of vaccines that are on the shelves. And we're not going to dive into the details of the vaccine, whether it's what Dr. Moore's group worked on, the Pfizer, the Johnson & Johnson. Obviously, we'll talk about that in a little bit. This is what it looked like. This is what we talked about at the end of 2020 and at the beginning of 2021, how we're going to get these vaccines out. I think it's immensely exciting that as of last Wednesday specifically, if you are above the age of 16, go get a vaccine. Now, obviously, the problem is the supply chain, and the supply chain, whether it's Moderna, Pfizer, or Johnson & Johnson, in various parts of the country has not caught up to demand. And in some places in the country, the demand has actually started to drop, even though they have plenty of supply. We'll talk about that a little bit too. And so when you're talking about, well, which vaccination should I get? I said this in December. Dr. Moore said this, I think, in January and February. And the reality is, get whatever one's available, right? If you have an opportunity to get vaccinated, get vaccinated. And I think that's really the take-home message from this. But we're not really talking about that because there are controversies on top. And so what are these COVID controversies? I think one of the controversies is this conversation about hesitancy. If you listen to the mainstream media or the media, whether it's main or unmain, one of the things that you always hear about hesitancy is, well, it's these communities of color. You know, these communities of color are going to be problematic and we're not really sure what we're going to do about them. So how are we going to get these people to get vaccinated? It's interesting because if you look at this, and this was back in November, December, the Kaiser Foundation came out and you can see ranked the groups that were most likely to be hesitant, right? Now, obviously, Black adults are up there. Other communities of color are also up there. I think what's been really interesting, if you break it down even further, is all those groups, except for really white Republicans, and if you're a white Republican, I apologize, maybe you've gotten vaccinated, but all those groups, as more and more of their friends have gotten vaccinated, as more and more of their family have gotten vaccinated, their hesitancy has dropped. And so the same Kaiser Foundation has actually been looking at this consistently since vaccines came out, and they now have a COVID vaccine monitor, right? And so you look at, well, does the public want to get a COVID-19 vaccine and when? You can see this here, right? This has already got it or plan to get it as soon as possible. No surprises that if you're 65 and older and you were given an opportunity or an option to get a vaccine, you got it. The reason you got it is because 80% of all the deaths for COVID in the United States in 2020 into 2021 came in the above 65 age group. That is the group that COVID targeted primarily. And so it would be crazy if you didn't. Now you can start to see other places, whether it's the younger groups, obviously, younger people always think they're invincible, and so they don't want to get the vaccine. But whether it's white, Black, Hispanic, you can see who wants it. And if you switch over to definitely not, it's an interesting breakdown again. right? And so I think, again, when we talk about hesitancy, hesitancy is not a conversation about color. Hesitancy is a conversation about communication. It's also a conversation about access. Have you given vaccines to these communities that you say are hesitant? Have you used mobile vans? Have you used conversationalists and communicators like Dr. Moore or like myself that look like them? And kudos to Dr. Fauci. He's done a great job through this pandemic, but a recent article, recent study this week reported that there was a percentage, up to 30% of people that specifically were not getting it because all they heard from was Dr. Fauci. People need to hear from people that either look like them, they know, or they trust. And who do they trust? Those arbiters in their community. In our communities, it may be the church, it may be a physician. And so really have been pushing on various state, local governments to get these vaccines into the hands of the primary care doctors who know their patients and can call them on the phone and say, hey, you need to go get this vaccine. Thoughts about this, Ian?
Yeah, I mean, you're exactly right. And so as much as you mentioned Dr. Fauci, as much as he is trusted and as accurate as some of the information that he has given has been, he can't walk necessarily into my community in rural Alabama and get these people to they'll be glad to see him. They'll shake his hand or say thank you for everything you're doing, but that doesn't really move the needle much when it comes to it. They need somebody that they know. They need somebody they trust. And you're exactly right. I had did a couple of talks across the state of Alabama, and one of the things I heard is that they were even tired of hearing people say how hesitant Black folks were, because it has changed now. It has changed now. Now, when it first started, yeah, everything was moving at light speed. You have a Operation Warp Speed. You have a name that I still feel was a very poor choice in name, because it just kind of gives you the assumption that everything was done too fast. And we can definitely talk about that later because it wasn't. But the bottom line is that I think now people, no matter what your political affiliation, your ethnicity, your background, socioeconomic status, I think everybody now has seen enough people die that they know that they need to get vaccinated. Now, do they still have questions? Absolutely. And this is where you and I and people like ourselves come in and have a Saturday morning conversation and fill in some of those gaps, because if we don't fill in the gaps with accurate information, those gaps will absolutely be filled in with misinformation, some conspiracy. And I have heard many of them, and we can talk about them later if you want to, but I think they're even worth mentioning sometimes. But yeah, so absolutely. So I think that's just kind of where we are. Please, if you're listening to this, open your mind up, take advantage of this opportunity that we're giving you right now, and ask those questions.
Absolutely. And I continue to keep this slide when I talk to various groups, just because I remind them. And I think Ty said it in the beginning, right? If the conspiracy was about vaccines and they really wanted to get us, and I'm somebody that's had a kidney disease since I was in my 20s, so I take various blood pressure medications, they would have put in our blood pressure medication or our diabetes medication, because the stroke belt and the heart attack belt is in the deep South. It would have been an easy way to wipe out the South. They didn't. So it's not about vaccines. And again, this is funny, but it's kind of tongue in cheek, right? For the working class Black folks who are still skeptical about getting the vaccine, just consider this. Think about how many rich white folks who are trying to cut in front of you in line to get it. And obviously, this was the early days, not the same, but again, it still holds a lot of power out there. Got to call out the elephant in the room because it's in the press, right? There's a conversation about Johnson & Johnson, the one-shot vaccine, which in full disclosure, I have gotten, that's what I got, with a condition called CVST, central venous sinus thrombosis. Now, you can see what's out here. Many of you have seen a cartoon like this or a graphic similar to this, and it talks about COVID, and pregnancy, and oral contraceptive pills, and the Johnson & Johnson vaccine. And I think this is all well and good. As a scientist and epidemiologist, I think it was also important for people to realize that when we look at true risk, you have to look at what's called stratified risk, right? And compare it to what you would have expected it to be in the normal population. And there are some concerns about Johnson & Johnson. The CDC and the FDA met yesterday and they have reapproved it. And I think that's potentially the right thing to do with some warnings, and people will make their own decisions, especially because Now vaccines are open to everybody. So people will now have an option or a choice of potentially what to get. I think, however, and this goes to not just the controversy around Johnson & Johnson, but the controversies globally, is when you say how safe or unsafe you think Johnson & Johnson is, you can see that prior to the conversation 2 weeks ago, when we put a pause, it was in the 55% range, and unsafe was around 25%. Since that pause, it has switched, and more people now believe it's unsafe compared to safe. That's the power of the media. That's the power of the conversation. And so I often talk to reporters when they say, hey, can you do an interview? I say, hey, if we're going to do this interview, it's going to be live time. I actually don't do a lot of recorded interviews or press interviews as newspapers anymore, because I've realized that a lot of people in the media, especially press, they have an agenda, and they're just trying to do clickbait. We'll talk about that a little bit later. Dr. Moore, I'm going to turn the conversation of variants over to you and sort of explain what's a variant, why is it concerning, but potentially why shouldn't we be afraid of it?
Right. So as I was kind of mentioning earlier in the conversation, we do have a couple of different variants that we have to worry about. So now, as I mentioned, coronaviruses are unique because they fall into a category of viruses that when they replicate, they have the opportunity or have the possibility of having a mistake happen in that replication cycle. It replicates. So if you imagine, it's kind of like making a copy of a key. You make a copy of a key and it fits your door. But over time, let's say that the teeth on that key change slightly. What happens is now the key and the lock no longer communicate because there's something wrong. It gets harder and harder to open the door, or eventually you can't, your key just gets stuck and it doesn't come. So what happens is these viruses replicate over time. And what happens is sometimes they have a mistake, and the mistake can either make, as I mentioned before, can make it stronger or can make it weaker. In the case of the three variants that we're talking about right now, we have three major variants that we're talking about. Now, we have an original Washington strain of the coronavirus that we've been talking about, and that was the one that actually hit the US first early in the pandemic. Now, over time, you have opportunities for the virus to continue to replicate, and then you have variants that pop up all over the world. You have one that's the South Africa variant. It's known as the 501 YV2 variant. But in general, I'm just gonna call them by their names. And then you have a Brazilian strain, it's called the P1. And then you have one that is in the UK, which is B117. And so these are the three that we're concerned about. And actually B117 is becoming the predominant strain here in the US. And so the concern is that what happens is your vaccine that you have potentially take, you put it more to the test because these viruses that have changed a little bit, they're sometimes able to slightly evade the immune response. But there's actually good news on the horizon, is that these vaccines are shown to be a lot more protective than first assumed. And so now, if you've been vaccinated, you have some protection. But I can guarantee you, if you have a strain that is new, like the B117 or the UK strain, that is potentially more transmissible, and the debate goes back and forth about whether or not it causes more severe disease. But the point is, if you don't have any vaccines on board, you are a clean slate, you're open book, and that virus can actually cause a lot of damage. So to have a vaccine on board gives you some protection, but these are the three that we're talking about: the UK, the Brazil, and the South Africa. And if they change enough, then sometimes they can evade the immune response and they can be more transmissible. So that's why it's so important that we get a vaccine on board and give ourselves some protection.
Absolutely. And I think one of the other things, and Dr. Moore said this as well, but I'll reiterate it, is vaccines mutate on their own. They mutate and cause these strains of interest or strains of concerns that he talked about, the 1351, 117, and the P1, when there's unrestrained spread of a vaccine. If you don't have unrestrained spread of virus, thank you. Unrestrained spread of a virus in the community, that's what happens. And so that's what happened in South Africa and the United Kingdom, and now in India, in California, in states, localities where they had so many people getting this virus constantly. It was putting a pressure on the virus, and the virus mutated. And so I think that is important to call out. We'll talk about that again when we go to open Q&A. And so sort of to close this out, a couple more sort of thoughts. From the beginning of the pandemic, we've had what are called non-pharmacological interventions, or NPIs. That's stay your butt at home, wear a mask, do your hand hygiene, avoid touching your face, don't go into a crowd, right? Ventilation. Now, again, government messaging and financial support, quarantine and isolation, a lot of these things have evolved and they've changed over time. The data now sort of shows aerosol is the driving factor. The whole cleaning that we did, hey, it was good. Your house got super clean, right? But may not have been as useful as it was. We now understand that physical distance and being outside is a great place to be. And now we have what I really believe is the last nail in the coffin of COVID. If we vaccinate people properly, we will get through this. I think it's important, and I talked about this before, but to call out again, right, that the people that bore the brunt of this were above 65, our parents, our uncles, our aunties, our grandparents, right? They bore the brunt of this 600,000 plus deaths. But that does not mean it didn't affect younger people in that 50 to 84 category or that 18 to 49 category. I'm going to keep pediatrics and kids out of it because it's controversial. We can talk about that another day. I think what's also important to understand when you sort of look at this is whether there is a long COVID or not. People are talking about a long COVID syndrome. We don't yet know. It's way too early in this conversation to know that. But if you had to take the shot of, I got COVID, oh, and this will affect me 10, 20 years from now, and I didn't get COVID because I got vaccinated, I think rational people will say, you know what, I'm going to go on the side of, I'm just going to take this vaccine and protect myself from not getting this, and the potential list of various disorders that are on this screen. I think it's really important. And so as we sort of look at where are we today in the United States and how we're going to get through this, and again, the conversation that we're having today is all about vaccines. You can see the vaccine distribution in the United States. It looks great. We went from giving an average of less than 1 million back in December to a high of, I think, 5 million or so about a week ago. What's concerning right now, at the point in time that we need it most, when we're having these variants and we're having these surges in various areas, is right here. We're starting to go back down. And so if you look over here, we have approximately, I can't do the math right, but I think it's approximately 60 million. There's a graph. My math is terrible. I'm just going to let the graph run it. Yeah, 59.18 million vaccines that are out there sitting on shelves. And so that tells us that we have availability, but people aren't taking the vaccine. And so that's where this conversation that we're having today becomes really important. My guess is that if you're on this call, you probably already had a vaccine. But my guess is also that you're an influencer, even if it's just to your family or to larger organizations. And so the more people that you can influence and encourage to get this vaccine and to get that news out there, I think it's immensely important. We are in an arms race to get through the summer and into the fall. I personally think the summer will be good in most places in the United States because of the open air, the different weather, people will be out and about, but we need to get to that herd immunity. The exciting thing about the herd immunity is that we know that it works. We know that if countries, Israel, the United Kingdom, actually focus on vaccination and get to around 40% of their population vaccinated, they have an amazing drop in cases. Israel, for the first time since last year, has reported 0 deaths for 3 days in a row. The United Kingdom has the lowest number of cases and deaths they've had in over 8 months, as they've gone above 45% of their population vaccinated. And so that is a measure that everybody sort of needs to look at. This kind of, again, I talked about the press and newspapers, not a fan that much anymore, but this kind of reporting really frustrates me. The vaccinated tested positive. They absolutely tested positive. But again, in this story specifically, if you look at it, it was 71 out of 23,000 people, 2 hospitalizations, and nobody died. That is exactly how the vaccine is supposed to work, by quote unquote defanging COVID, making COVID less dangerous, making COVID even potentially less dangerous than the normal influenza that we have every year. And I think that's really important for people to understand. That's St. Louis. If we take the totality of the data that's out there, you can see across the board on average, it's less than a 1% infection rate. And the majority of these studies, they weren't looking for the person. It's not like you got vaccinated and you were sick and you went to them. They were like, hey, you got vaccinated and you work here. You mind if we test you? And they went looking for it. In people that were actually symptomatic, you can see the numbers at the bottom from the CDC, less than 0.008 percentage points in hospitalized and death. And so I think those are all important numbers for you to be able to go back to your communities and your friends and say, hey, these vaccines work. And let's talk about the controversies and why you don't want to get them. Again, I've shown this before where I've talked about, hey, the conversation in the press is you're fully vaccinated, you don't know what to do. That shouldn't be the conversation anymore. I think we've been talking about this prior to the CDC, and the CDC has come on board. Vaccinated and vaccinated, free field to mingle. Vaccinated and unvaccinated, because of societal norms and public, not necessarily because of risk, but to send the right message, still appropriate in public to wear a mask. And to unvaccinated people, keep all the restrictions out there. Again, more than enough data that shows that these vaccines not only prevent you from getting sick, but also prevent asymptomatic infection or what's called transmission. And whether it's in Israel, the United States, England, you can see these, and I'll send out the slides if needed. And for me, this is the best side effect of a COVID vaccine. The ability for our seniors to hang out with their grandkids again and their kids and themselves once they've been vaccinated. This is the hope that we need to tell people that this is the only way we get out of this. And so sort of in closing, I think we have touched on a couple of topics. We just want to remind people that normal, depending on where you live and depending on the sort of dynamics in your community, may not have been working for you, right? And so a lot of us learned a lesson in 2020, and I hope that we'll never forget those lessons and we'll be able to take them forward to be better people going into the future. 2020 was about masks. 2021 is about masks and vaccines. I truly believe, I think Dr. Moore agrees that vaccines are the way of the future. Thank you very much for your time, and let's get it on.
All right. Excellent
Okay.
presentation.
Before we open it up for everyone, so everyone start thinking of your questions. You can either PM me or one of the other hosts. But I have a few questions that were sent in prior to the actual presentation. I want to thank you all. This presentation was amazing, again, as always. One of the questions is about the reinfection rate. So you get vaccinated. What are the odds of you being reinfected?
I'm just going to go straight back to the data, right? I mean, hold up a second. Did I put it? Where did I put it? Did I lose it? There we go. I mean, that's the answer to the question. Whether you want to say it's less than 1%, whether you want to say it's less than 0.008%, you pick a number. But I think if we had talked about this in March, April, or May of last year, that this was how effective these vaccines were going to be, nobody would have believed it, right? I mean, these vaccines have outperformed their wildest expectations. I mean, Dr. Moore is in the center of that sort of hurricane and academic thought process. And when you guys were working through the vaccine process, what was your best guess as to how well these would work?
It was our hope that these vaccines would be at the very least 50% effective, and actually 50% is the bar that you need to cross in order to get FDA authorization or clearance or approval. And so, and I can say I was literally one of the first people to see slides, pathology slides from these studies, and to see how effective these vaccines were in the animal models. And it doesn't surprise me, based on what I saw, that they are 94 and 95% effective, because that was exactly what I saw. I saw almost nothing. It completely neutralized the virus. And so I would, to the point where I actually had to go back and check multiple times just to make sure I saw what I saw before I reported this information. The bottom line is that we see that the vaccines work. We see that wearing masks work. If we can hold on to both of those just for a second and let people get vaccinated, we'll move in a very good direction. Just think about this for a second. How many people on this call have had the flu this year, or have heard about people having the flu this year? Almost none. Probably none, because the reason is because people have been wearing masks, and respiratory droplets are how flu is passed. Coronavirus is very similar in that case. It's transmitted in the same way. It's just more severe. And so getting a flu vaccine, getting a coronavirus vaccine, you just take away the risk, and you take away the opportunity for those situations to be damaging to you. And it's not even just about you. It's about the people around you, your family. If you care about your family. I told a guy other day, we were talking, and he said, well, I'm not going to get vaccinated, but he had questions. And so we talked. And so at the end of the conversation, he changed his mind. He did a complete 180. But my point was that if you're not going to get a vaccine at this point, then you need to maybe get stuff in order from a after standpoint, because you're potentially as a man, potentially, or a woman who is a provider for your family. If you choose not to get a vaccine, you're leaving everything at risk. You're leaving everything up to, if something happens to you, this is different. This is not the flu. This is not a situation where you get sick, you go to the hospital, and everybody can come in and visit you and bring you flowers. No, you're on the other side of a MacBook, or other side of an iPad, with a nurse that's in a full suit holding an iPad so you can see, if you're fortunate enough to still be conscious. So we Dr. Alozie and I have already agreed that we don't want to do a doom and gloom presentation. We don't do that. But I also don't want people to be, unaware of the real side effects of what could happen. You could avoid all of that just by going down to your CVS, going to your whatever place in your area gives vaccinations. You get a vaccine, you get 2 shots, 2 weeks after that second shot, 2 or 3 weeks after that second shot. Now you're in a situation where you can at least breathe more comfortably when you go out. You still wear a mask, but you're not sitting there worried about having no protection. Is something going to get me sick? Now you're protected. Now you're protected in a vaccine. I'm sorry, I'm being long-winded, but the other part of it is that a vaccine is not meant to give you 100% protection, even though 94 and 95 are very high. A vaccine is meant to give you protection. If you were ever to get sick, you have a runny nose, you might have a fever for a couple of days, you might have some body aches, versus you being on a ventilator on the other end of an iPad. And so that's a vaccine is meant to keep you safe and make any potential infection very mild and almost non-existent. And so that's where we are. And so I want to make sure that people understand that getting a vaccine you have so many theories out there right now, but these are, I'm coming to you, Dr. Alozie coming to you. We're talking to you about the truth. We can't make it any clearer than this. So definitely get vaccinated, take care of yourself, and enjoy the summer, and safely enjoy the summer. So yeah.
I must say that this is what, our third call, Dr. Alozie? It's our third call.
Yeah, number 3.
I think we have changed about, what'd you say?
Repeat.
Yeah. So we've changed approximately 50 to 60 people's minds about the vaccine. I get text messages, I get emails, because this is pure facts, is real information, and people, including myself, I am now vaccinated, fully vaccinated, because of these calls. And so is my husband. We are really making a difference. And I just really want people to take this information back and share it. Take the real information back, because people are so good at sharing the myths, the rumors, the falsehoods. Please make sure you share this information as well. So thank you for breaking down that reinfection rate. I know we had talked about it before, but I just want to make everything in layman's terms, as if possible. That way people really understand, and when they can go back and speak to it to their friends.
Right.
I'll say one other thing. Hey, Ms. Jones, I'll say one other thing, right? I think it's important for people to realize, and again, this is my problem with some of these online newspapers these days. What they're trying to do is get you to click on the story, right? But if you look at the second level metrics, 80% of the story is never read. People read the headline, read the first 2 sentences, then they send it to their friend. Or they call, hey, bro, did you hear about that stuff going on in St. Louis, man? They're killing people in St. Louis. 71 people got infected. What they didn't tell them is that it was out of 24,000, and oh, by the way, they went looking for that 71. These are not 71 people that came to the hospital. They said, hey, we need to come check you real quick, right? That's not how life works. You and I don't go to the hospital just because, right? I might be working, you might be working, anybody on this call could be working and feeling just fine, may have a virus in the back of their throat that is not transmissible and is dead virus. But because we have a test, they put a thing in your nose, all of a sudden you get on the St. Louis Inquirer. And so I think, again, people need to understand that clickbait and the process of the media is not always the truth, right? And so I think hopefully we can help discern some of that, and hopefully at times they can discern some of that.
Yeah. Another question that I had come in earlier was third shot. I think that may be you, Dr. Moore. People are like, look here, I already stretched myself by getting 2 shots that I really didn't want to get, but I'm doing it to help myself and my community, right? Now you're talking about a third shot?
Yeah.
So
yeah. Well, look at it like this. A potential third shot would be, it's just like and this goes back to flu. It's just like a flu shot. You go and get your annual flu shot every year. You should be, if you don't. Now, the third shot, the potential third shot is coming from the fact, and actually companies are preparing for it should they need to do it. Nobody even knows right now how long the immunity lasts from the ones that we have right now. So we're still because we're moving through real time. In a pandemic, you can't, in a normal vaccine process, when there's no pandemic, you have people who are in the clinical trials as we've had before, phase 1, phase 2, and phase 3. And you take those people and you follow them out for 2 years, 3 years. And what they do is over that time, they check their blood to see how high their titers are. And then what happens as those people, what they call breakthrough infections. So the people who are vaccinated now 3 years out, 1 or 2 or 3 of them start to have report they were sick or were positive for the virus or whatever virus they were vaccinated against. Now you have an opportunity to say, let's check their blood titers and say, okay, this is the threshold. These are the areas that they need to, a level of 1,000 is where they need to stay to keep from getting infected. That's how you determine what is a protective titer. And now we don't know that because we can't afford to go 2 or 3 years and not vaccinate the rest of the population and just follow these people, because we would lose millions of people. So what happens is now we're doing it real time. And so just recently they announced that 6 months out, people who were vaccinated against, I think all 3, with all 3 vaccines had high titers. They don't know what's protective, but had high antibody titers out to 6 months of, and so they're going to continue to follow them for the rest of the year. And they'll probably report at 12 months and they'll continue to, they'll report at 18 months. They'll keep going out. But in the meantime, we know that not getting vaccinated is putting you in a position where you potentially get sick and die. We've lost at this point now 570,000 people in the US. I mean, just give you an example, we are in a very quiet place right now, which is good because I think we're getting vaccinated at a high rate. And then some of these variants are the variant that's circulating here right now. I think some of it is weather, outdoors, the policies that are in place. But if you look at India right now is going through something extremely severe. They actually beat the record of the highest number of daily infections that anywhere since the pandemic has started, 330,000 cases. That's crazy. And they are running out of hospitals, people are dying in parking lots. And so when I see that, I'm thinking like, we need to make sure that we get vaccinated here. If you're sitting here, listening to this call, and you're not vaccinated, just give yourself that ease and that confidence of getting a shot, just in case that wave comes to the US again, because it could. We have variants that are circulating, but give yourself that protection. So that's all I'm asking. But a third shot would be just a booster to give you a stronger immune response, to get your titers back up so that you can continue to protect yourself. Same thing with the flu shot. You go to get a flu shot this year, the virus changes, and then you have to go back and get another flu shot the next year because the virus changes enough that the previous year's immune response might not recognize this new virus. So don't get worked up if you don't have to about a third shot. A third shot would be just something to keep you protected and keep you safe and keep your titers high enough where you don't have to worry about anything else. And it would be only one shot. It wouldn't be another 2-dose series. It'd be just one shot to get your titers back up.
now, will you have to have a card, another card, or have you guys thought that through? That was another
I
question.
yeah, I don't think so. Right now, most people, what I've been telling people is they don't have to have a card necessarily, but if you do get a card, I've been telling everybody, take a picture of your card and store it in your phone like a photo and store it in your documents. If you're worried about, I don't think there's going to be any situation right now where we have to travel or you travel around the country and somebody's going to say, well, let me see your vaccination status. Now, if you are worried about that, very easy. You have a trusted friend or a close relative, take a picture of your card, keep it in your phone, but send it to them just in case something ever happened. They can send it back to you, send it via email to a close friend. It's like giving your friend a key to your house. Just somebody else has an extra key that they can give you if ever you lost yours. But right now, I'm pretty sure there's going to be some digital card of some sort, vaccination card of some sort that will be coming out pretty soon if it isn't out already.
Okay. Another question is I think this was a clickbait story, but someone asked the question. There was a headline about the vaccination causing herpes. Now we know they're talking about shingles. We know because they don't post the story. They just post the headline that the vaccine is causing herpes. They don't read the story. People just post it. Little Duval. I mean, just everyone posted it. We know that they're talking about the shingles. Can you please speak on that? You or Dr. Alozie, please talk about it.
We need to get our hands on little Duval first of all. Yes, online. So, I mean,
the better point is why is he the source of your information? That's
why is Duval why is he your medical information, man?
And the funny thing is a bunch of people shared that and was talking about that, but guess what? They won't share this, So
exactly. Bad news and negative information travels way faster than good news anytime. Think about when you're at work. If you had a story about somebody, and not you personally, but if you hear something about somebody's gossip.
Yeah, don't say me because my manager is on, so don't say me.
But if you hear a story, if somebody says, "Oh, did you hear about this person?" That information travels extremely fast. But if you say, "Hey, this person did a really good job at this," can you? Nobody want to pass that along, So if you don't mind, Dr. Alozie, let me go just for a second. So the herpes story, and I'll even top that because I think it's important to put myths out there, but to also to tear them apart. I had a person on a call that I did, and this person was a medical professional, and they asked me, well, why are people who got vaccinated with COVID testing positive for HIV? Now I heard that, and the person was dead serious, and I just immediately. Usually I'm pretty good I have a poker face when it comes to question like that, but at that point I was like, but that's not true, and so I would like to hear that because I go back and look it up and do my research and find out how to debunk it. And so what it boils down to is that there was a group who was actually thinking about using a protein that was associated with HIV infections, not something from the actual HIV virus, but a protein that was actually associated with it, that if you were to use this protein, it would cross-react and would essentially show that you were positive for HIV. Needless to say, it never made it to clinical trials for that exact reason. They were like, there's no way we can go forward with this technology because of that fact. But somebody saw that headline, HIV cross-reactivity, or HIV positivity in COVID, and they went with it, sent it to everybody. And so now you have medical professionals who are actually, in some cases, propagating this information. So the herpes thing too, there is no virus in any of these vaccines, definitely not herpes. And so if there's no virus, if you can't get COVID from it, how can you get herpes from it? Exactly. I'll just leave it at that, because if you can't get the virus that you can't get COVID from it, you can't get anything else from it. You can only get protected. Now I'll step back. I'll let the professional take over. Dr. Alozie.
No, I mean you answered it a lot longer than I would have answered it. I mean, so you know how it is. You get those friends that call you and troll you, send you DS all the time. You're like, at some point in time, you gotta say, bro, or sister, are you on this train or not? Are you on the Earth train or not? And so, hey, sometimes people don't want to be rational, and that's okay. That's okay. I mean, the reality is we need 70%, right? We need somewhere between 60 and 70% to get ourselves back. We're not going to win 100% of the battles. And so I think 100% win rate is a high line. We just got to convince enough people that are rational and are willing to listen, like a lot of people on this call, just to say,
Right.
hey, I mean, yeah, you're afraid of the shot. Understand it 100%. Understand it's a brand new shot. Also understand that people like Dr. Moore were involved in it. So we're at the table in this conversation. So it's not to eliminate us. Also understand that your daddy, auntie, and uncle are probably on metformin or hydrochlorothiazide. If they really wanted to get rid of us, they would have killed them off 20 years ago when they got their hypertension and their sugar diabetes. So, I mean, we gotta have conversations with people that are data driven. At some point in time, you just gotta call BS and say, yeah, that's BS. Let's move on.
I have some questions in the queue. So this is from Demond Flowers, and he said, why is testing not universal? For example, why do some countries not take the rapid test? Why is the US the only country that does not check swab? That does not check cheek swab?
So again, I think part of it is all about different countries have different regulatory agencies, right? They have agencies that determine what tests can be used and what tests can't be used. In the United States, we've primarily done the nasopharyngeal or the brain biopsy process, right? Other places will take the oropharyngeal, back to your throat. And other countries have developed technologies or used technologies that are cheek or saliva, just spit into a cup. You know, it's interesting when we talk about the differences in testing is, so I'm here in Curacao doing some COVID work for their hospital here, and Ian knows about this, but they use the cycle time as their cutoff, right? So it's not just a positive or negative. If your cycle time is above 30, they discard it immediately and they say it's dead virus. And so we, the United States, knew about cycle time last year. I mean, Ian knows about it, virologists know about it, but for some reason we decided not to use it. I believe in the postmortem of COVID, when we go back and say, what were the missteps that we made? I think that's one of them. I think we should have given people a cutoff. We had enough data around it, July, August, that would have helped people a lot. But to answer that question specifically, Ms. Johnson, different countries just have different rates or different preferences for testing. Some people like Nike, some people like Adidas, some people like Jordan, some people like Braun. I mean, neither is bad. They're all great. It just is what it is.
Yeah.
But Jordan is the greatest, just FYI. You know, you see my cousin's room. You see my cousin's room, so. But anyway.
Let's keep it moving. Let's keep it moving.
So this is from Chris Nelson, and he said, thanks so much for the information. Having grown up in St. Louis and now living in southeastern Wisconsin, Racine, Kenosha area, my hometown. Only one of my friends has agreed to get vaccinated. I find it very discouraging and don't know what else to say to them. What is your advice on how to discuss with my friends? I appreciate all this information. Secondly, is it safe to go back to the barbershop once vaccinated? I need a cut bad, LOL. Now for me, I would go to beauty parlors, beauty shops. I have been in the beauty shop since last year, just FYI. And I've been in the nail shop, but I don't know. You guys can take this on.
Yeah, so I mean, and Ian will dive in on this. I think communication 101 is acknowledging we don't know everything. Right? I mean, myself and Ian aren't going to sit here and say we know 100% of the information about COVID or the vaccines. That's crazy. I think part of that is saying, yes, you're absolutely right. Do we know what the vaccine will do 10 years from now? No. But what we do know is what getting COVID will do to you on average today. We also know, and this is from a host of data, not just thinking about it or maybe, we also know what getting the vaccine in a state, country, and worldwide situation will do. And that's evidenced by Israel and the United Kingdom. They had some of the worst COVID epidemics in the world as of December, January. And they said, hey, we're going to vaccinate our people. We're going to get to 40, 50% of our population in under 60 days. They did it, and they're no longer talking about COVID. In Israel, they just opened up, no masks, You can go wherever you want in the country. The United Kingdom just allowed O2 Arena, which actually holds 70,000 people, to hold a concert for 3,000 people as a test run. They're opening completely up. If we want to get back to that level of normal, we're going to need to get vaccinated. And so again, it's a negotiation process with your friend. I will say, in terms of the barbershop piece, this is aptly named COVID Barbershop. Since I've gotten vaccinated, well, I actually got COVID, so that's a different story. But yeah, I go to the barbershop. I've gone. My barbershop's been great. You can only have 2 people in there at a time, and then you go in, they clean everything down, and then they kick you out. You can't hang around. You can't hang around and talk about COVID in the barbershop anymore.
Yeah,
Yeah,
this is only COVID barbershop right here.
Exactly.
No, but I completely agree. I think, at this point now, but if you take a lot of the concern off the table if you do get vaccinated, and then you can start going back to some of these things. But the point is, do it in a safe way. Do it in a safe way. Still wear a mask, and then go to the barbershop and get cut. As long as your barber's wearing a mask and you're wearing a mask, you should be in a very good position. But on top of that, you have a vaccine. You're protected even if you were exposed. You have a whole lot more protection than you would if you went to the barbershop and you said, I'm gonna wear a mask, but I don't have a vaccine. Or if you said, I'm not gonna wear a mask and I don't have a vaccine, then you're setting yourself up for a much different outcome. Same thing for women who go to nail shops and beauty salons. Same scenario. Just take precautions until enough people have been vaccinated. That's kind of common sense survival right there. I mean, just don't put yourself in a position to potentially get exposed if you can help it. So wear a mask, get a vaccine.
Absolutely.
I see somebody's hand is up.
Yeah, we have some people
Yeah, there's a
who
bunch
have
of
their
hands.
hand raised.
Okay.
Yep.
Oh yeah, I
Paul
have a
Daniel.
question.
So I would tell anybody unmute and ask your question, because I would love to hear your questions directly.
Go ahead,
I was
Mr.
wondering
Daniel.
Thank you. I was wondering what sort of incentives can you give to people so that they can actually go get the vaccine?
I think that's a great question. It's a conversation that we've been having in Texas. Unfortunately, because of the political leanings of Texas, it's not going to happen. But I sort of mentioned something earlier, right? You can't talk about hesitancy when you haven't talked about, hey, you get a paid day off to go get vaccinated, right? Because if I'm a gig worker, or if I'm an employee that only gets paid if I clock in, what incentive do I have to lose a full day's pay potentially, or the next day's pay if I don't get vaccinated? And so I think there are some companies that are actually incentivizing their workers to go get the vaccine by paying them to do it, not just giving them PTO, but saying, hey, we'll give you an extra $100 or extra 150. Right? So I think there has to be unique ways that various parts of the population get incentivized. Because like I showed, we've sort of hit a peak at our vaccination rate, right? I think this remaining 40+% people, 30-ish, that haven't gotten vaccinated, they're going to need convincing. You're going to need to give them a reason other than just go do it. And so I think that's a great question, Mr. Daniel. Dr. Moore, what do you think?
I mean, on the other side of it, and I do agree that you definitely need some kind of incentive, but then the other incentive is, honestly, the other incentive is just to be here, just to not experience that. The incentive is living, and the incentive is living. Another statistic that I actually just recently heard is that a lot of people who experienced COVID have this goes back with long COVID, have a number of issues. Some of them musculoskeletal. They have hand tingling, and just some people have mental fog that happens as a result. As a matter of fact, I heard one doctor, I actually read the article, but they mentioned that about a third of people who have had COVID infections end up having some kind of COVID fog or some kind of neurological issue associated with the effects of having it. So once again, if you want to take those things off, just remove those from the potential for even happening. It's as simple as getting a vaccine. So I don't know what incentive. I agree, you need an incentive, but I don't know what incentive is more important than your livelihood, your ability to live and thrive. That's all this incentive I needed, because I have seen people that I know people that didn't make it. I know people, my father-in-law, my father-in-law died of COVID back in April. It was a year on the 13th of this month. And so that was before a vaccine was available. I know moving forward that had he made it to this point, I could have absolutely got him vaccinated, no questions. He would have been here. So, you know, for me, when somebody asks for an incentive, I'm like, think about the people who love you. You being around, you being present. Or imagine yourself right now being in a hospital. You're sitting in your house Saturday morning. Imagine being in a hospital right now and nobody can come see you. Or you can't have a funeral. That's all the incentive I needed, you know, and that's why I do this. That's why I get up on a Saturday morning and talk to people, because I don't want anybody else to experience that, especially if you don't have to, especially when you have 3 vaccines that work and work so well that you don't even have to consider it. So that's my incentive right there.
And I would like to chime in. I saw the incentives pay off this year already, because we hadn't seen my mother. My children hadn't seen my mother since December 2019, right? Christmas. And then I hadn't seen my mother and my father since March of 2020, because I went to see them for her birthday. And just for Easter, she came to town. So that's an incentive as well. She came to town. She was able to see my kids. I was able to see them, hug them, you know, spend time with them, because we're all vaccinated, right?
Mm-hmm.
And so that's an incentive as well. So,
Exactly.
you know,
Exactly.
think about
Kind of
that.
the intangibles.
Okay, I see someone else that just says L and their hand is raised. So you can come off of mute and ask your question. So maybe they don't have a question anymore. I have another question in the queue from Demand Flowers, and it says, I think you may have covered this, but I just want to make sure that he's okay with the answer.
Actually, I'm here. I couldn't figure out how to get my mute off.
Okay,
No problem.
go ahead.
Okay, so, and I know that this program is to try and encourage people to get vaccinations, and I just tell you that I'm a person that does that. I've had success with getting vaccinations against pneumonia, the flu every year, shingles. I'm 59 years old. I haven't had problems with those types of vaccinations. I had my first Pfizer vaccination, and I noticed afterwards that there was like a tingling sensation on my tongue. And I wondered if that was just me being overly sensitive, okay? And maybe even a metallic kind of taste. Then it was 4 weeks later when I had my second shot. Oh, I should tell you that I called even into like a teledoc, and they told me to take Benadryl, which really did nothing, okay? So the symptoms went away gradually, but not completely, but pretty much almost completely. And then I had my second shot, and immediately my tongue began to tingle again. My face began to itch. They put me over into the line to get checked, and everything, all my stats were normal. They sent me home. I went ahead and I took Benadryl again. And because then I noticed under the arm that was shot, my armpit was itching extremely. And so, and I still, then after that, I noticed my emotions, and I was very startled very easily. And I was crying at the drop of a hat. It was like really strange. And I knew this was not a normal thing for me. And so my question for you is this, I know that sometimes when people are exposed to an allergen, something that they're allergic to, they'll have a reaction, but then they're exposed again, it gets worse. I'm wondering if I am somebody that is allergic to something in the shot of Pfizer, and maybe the next time I'll have a worse reaction. And then the other question is, I did a little bit of research on the tingling tongue, and the only thing close I could come up with was that I had a very mild case of Bell's palsy. They're saying some people have that and don't even know that it can be as simple as like pins and needles on the tongue. What are your thoughts?
Yeah, that's a great question. So I'll take both of them, but I'll tell you that the tingling is not unknown. I mean, it's actually been reported. I've seen reports of it. People having that metallic tongue, actually, more than the tingling. It actually does happen. And so it is unfortunate. It's interesting though, sort of the emotional ability that you mentioned of. I haven't seen that either from CDC reports, WHO reports, or the vaccine adverse reaction system, the VARS. And I do think that if you
So sorry.
don't have your link, no, you're fine. I think that if you do have your link to VARS, you should actually document that in the VARS system, because I think it gives the people that are watching that, see if it's happened anywhere else, and they'll actually reach out to you. I had a friend that had a local reaction on his left shoulder, and his whole arm got red. Not like the whole arm, but to his elbow, he had a rash. And that's been reported in hundreds of local reactions now. And so it's now a call out when people are getting vaccinated. So I think it's very important that no matter what your side effects are or may have been, that if you have that link to VARS, that you actually report it so that somebody can take a look at it and potentially reach out to you.
Can you please tell people to make sure that they get that link? Because I think I'm the only friend out of the people that I went to go get vaccinated with who actually signed up and reported my symptoms. Now, VARS is stalkerish, just so everyone knows. But can you guys please just tell everyone, because when I tell my friends, hey, are you reporting daily? Because for the first week you report daily and then it goes to weekly. They're like, what are you talking about? I don't know what you're talking about. I didn't get that. So can you guys just speak to what VARS is?
Yeah, I mean, VARS is the Vaccine Adverse Event Reporting System. It's a QR code that you get, or a link that you should get in a piece of paper whenever you get a vaccine. And here's the reality: 80+% of people throw it away and they're like, oh, more paperwork. I ain't about this. But especially things like this that Elle just reported on, and a host of other things, even the people that complained of the cerebral venous thrombosis, is because of VARS, they're able to go look at them. And so if you don't report your side effects, you're never gonna know. I will say this, remember, VARS is open source. Anybody can look at it, anybody can report. And so if you're one of those people that decides to go look at VARS, you're going to see a lot of junk that's in there. People reporting that their foot fell off or their head fell off or a whole host of things. And this is true talk. It's actually in there. So again, but if you actually have a concern about a side effect, I think it is important to report it to VARS and let the people at the CDC take a look at it.
I think it's important too to report that you didn't, because then it gives that positive
Exactly
as well.
Absolutely. Absolutely.
So make sure you guys, when you get vaccinated, even if you start at the second dose, make sure that you get that QR code and report. That way they know what's going on.
Absolutely.
Elle did that answer your question?
I think it says she left.
Oh, okay.
I think she got her answer and left.
Okay. I'm gonna just hit on Damon's question again. He inboxed me. I know you guys have answered this, but I'm just gonna read it and make sure that it's answered to his satisfaction. With the vaccine being so new, how can we be sure that this vaccine does not cause long-term effects to the body? Has there been any deaths related to the vaccine?
Right, I'll take that. So in particular, mRNA technology we're talking about. So it's new in the sense it's new that we've actually used it for a authorized vaccine, but it's not new in the sense this has actually been around for 20 years. The technology has been around for 20 years. It's just that we've never had a pandemic. It's perfect for a pandemic because we're able to mass produce a vaccine and protect ourselves. But the interesting thing I want to make a point to Damon as well, because that was a really good question, is that this, and I hate to keep calling it technology because technology makes it sound sometimes scary, like we don't know a lot about it. This method of vaccination, this is exactly what the virus has been doing for 10,000 years. The virus infects the cell by injecting its viral or mRNA, its viral sequence. And so it's giving the instructions to your cell. It takes it over and says, hey, I need you to make some more of me. So build each little piece like a GM factory in Detroit. I want you to build doors, hood, engine, the chassis. I want you to put it together. And then what happens is a new virus particle gets put together and comes to the top of the cell, goes off, and that new virus particle can now infect other cells in your body. So we just got smart recently, 20 years ago, and say, hey, maybe we can use that information and we can jump in front of the virus and we can give your cells just enough information to make something, not the virus, but to make a piece of it that your body recognizes, the most important piece, make an antibody response to that piece. Now you protect yourself anytime you get in contact with the virus. So it is new in the sense of us using it as a mass vaccine, but the technology has been around for 20 years. And so that's the reality. And so, yeah, we don't know, we can't know 20 years from now what's going to happen. But as Dr. Alozie was just mentioning, I can guarantee you what's going to happen if you were to get sick here and what those effects would be. So the question is, which one do you want to gamble on, getting COVID or a potential for something that otherwise is safe and has been given to 150 million people so far, and none of them have had any adverse reactions. Nobody has died from the vaccine, but people have died from COVID after getting vaccinated because they didn't take precautions soon after as they got vaccinated. They didn't wear a mask. They got a shot and went out the next day, and you can still get infected. That's why there's a period after vaccination that you have to allow antibodies to build up and protect yourself.
Yeah, I think that's important, Demond, right? That nobody has died from the vaccine, right? But we know almost 600,000 people plus have died from COVID. So, I mean, again, because I can see your videos on, I mean, I don't know if you've gotten vaccinated or not, so this is not about you, but I have a lot of friends that are younger than me in their 20s and 30s. They're like, I ain't getting this. Why I gotta get this vaccine? And I'm like, okay, that's cool. But you still live at home with your mom, and one of you goes to take care of your grandpa every other week. And that's cool if you don't want to, but please stop going to see your parents. Go get your own apartment, live on your own. If you get infected, get sick on your own. Don't give it to your mom, daddy, or grandpa, right? Because that's just selfish at that point. And so sometimes talking to people's better angels is hard. I get it. But it's also not fair if you say, I don't want to get vaccinated, but I'm going to put all these other people at risk. I think that's a different conversation.
Yeah, exactly. Think about the people who are around you, who love you, and who depend on you. If just hypothetically think of yourself not being there tomorrow, and it's happened to a lot of folks. They didn't plan on getting sick, and they didn't plan on not coming back home, but that's the way it happened. And so, that's once again, that's incentive enough for me to say, hey, I need to go ahead and protect myself. So I got vaccinated. So once again, I'm not on the soapbox telling you to get vaccinated, and I haven't done it myself. I got vaccinated. My mother, who was not a strong vaccinating person, she got vaccinated. If I can talk my mom into getting vaccinations, I can talk anybody. And I'm like, she gave birth to me, and she was still like, I said, no, let's talk. And so we talked, and we got her there. So yeah.
I got to tell you a story, man. So my mom did the same thing. So my mom's in Nigeria, right? And she hasn't come out of her little neighborhood in like a year. She's like, I'm not going to get COVID. And then she sees everything that I'm doing on CNN and BBC and the rest. And she called me like 6 weeks ago. She's like, I'm not sure if I'm going to get this vaccine, young man. And I was driving. I nearly swerved off the road in shock.
Hey.
I had to stop and say, wait, what? She said, she listed all these things, and she hit every highlight of. I was like, damn, this one on Facebook, she's 76. Her social media game is strong. And I had to tell her, we had the conversation, then we got to threats. I had to tell her, if you do not take this vaccine, you are not seeing your grandchildren this year. So check yourself. You make a decision on what you need to do. And a week later, she went to get her shot.
Yeah, man.
So I was like, what? My own mom?
Hey. Yeah, man. Hey, that's the point.
We're changing lives. 50 people, 60 people, getting buildings to get vaccinated. And my damn mom didn't want to get vaccinated. I was like, you are not going to shame me.
Yeah,
put a generational curse on me.
But I think it's important for us to share that, because somebody once again thinks that we're just regular folks who happen to have a different perspective of this process. It's almost like if anybody on this call, it's like if back when we used to play Nintendo or play some game and you have a cheat code and you send it to your friend, and your friend's like, oh, that man, I should have been doing that a long time ago. That's exactly what we have, a cheat code right now. We're telling people what the 2 times to the right, AB, and you can save yourself. And that's exactly what that's what we're looking at right now. We have a vaccine, and I'm speaking directly as a person who started when this vaccine was a conversation. And then, a year later, after all these, after all these experiments and studies, I mean, and that's the other thing. Damon, I want to speak to you as well, but everybody. But there are so many levels of protection between you getting a vaccine and it being designed. That's the other part. I know a lot of people think that it's getting mixed up in the lab, and then all of a sudden somebody says, hey, pull your sleeve up and let's get a shot. These vaccines were, first, there's a lot of conversation and talk and debate on how to start it. Once it's an idea, then you have preclinical studies, which is what I did. So at my level, preclinical safety and efficacy. If that vaccine if I see anything that is not safe or not effective, it never makes it to people. It doesn't even start the phase 1, but it goes from preclinical, gets the clearance, phase 1, phase 2, phase 3, then has to go before another board. Then that board submits it to FDA. FDA has to roll it over. Then you potentially get a vaccine. So there are like 5 different levels of protection before you get a vaccine. So if there was anything, just like the Johnson & Johnson, they didn't have to pause it because 6 people out of 7 million people had very rare blood clots, but they did. They paused it because they wanted to instill confidence in people that this system works. And on top of that, they didn't just pause it. They paused it and looked for more. They were asking people, hey, if you see this, report it. And at the end of the day, it was 15 cases out of almost 7.5 million vaccines administered. That's why this past Friday, they opened it back up, because now they're going to have a different set of information that maybe if you fall into this particular category, this might not be the vaccine for you. But even with that being said, Pfizer and Moderna both have enough vaccine to actually vaccinate the rest of the country if they want to get vaccinated. So we're in a good we're in a good space either way. And Pfizer, I'll speak for Moderna and Moderna. You got 150, 140 million people vaccinated, and you have had no adverse reactions and adverse events reported to that nature where anybody is dying from the vaccine. That's just a fact. Anytime you can do 145 million of anything and you don't have anything that comes back negative, you're in a pretty good spot against something that 200 times, you're 200 times more likely to get infected by the virus and to die from it than you are to develop blood clots using the Johnson & Johnson vaccine. So just using those odds, if you're a gambling person, I'll take those odds any day over getting infected with COVID.
Damon, did that answer your question? You want to come off mute?
Yeah. Yeah, it did answer my question. And, I took the vaccine in the first wave. The reason for my question was basically when you scan social media, you see a lot of that hesitation and you see a lot of the rumor mill going around. I was approaching someone yesterday about jumping onto this to get more information about it because they didn't believe in vaccines. And she told me that, oh, my brother passed away from taking that vaccine. So, I didn't want to dive into that, but I did want to bring that question up to verify.
Now, as unfortunate as that is, I can assure you, just to give an example, I was talking to a lady. This was not me doing a talk on a platform. I was just going to the store, and it's a store that I go to frequently. And there's a lady, a Hispanic lady that works there, and she was, she would see me. She said, "Hey, how's it going?" Of course, we only know each other from this, so she only knows me from the eyes up. And so I see her, and I say, "Hey, how's it going?" And I don't know how I'm usually not I don't just go out and start having conversation with people about vaccinations. I try to compartmentalize it. If you want to talk about it, I will, but I won't just bombard you all the time. Talked to her one day and we just been talking, and finally she said, man, she said, I don't know how we got on it, but she said she essentially wasn't going to take a vaccine. And I just kind of shook my head. I was like, oh, here we go. I gotta jump in this. I can't not say anything. And I said, it's funny you say that. I said, so can you tell me why? I'm just curious. I said, why? And she said, it was because her brother, who had gotten vaccinated recently in Florida, got sick from the vaccine. She said he got vaccinated, and then the next day he developed bronchitis. That's exactly what she told me. And so I said, see, the thing is that I could tell you right now that I could put out a headline and say a side effect of vaccines is speeding tickets. because when I went to get my vaccine, I left the clinic and I drove home. I got a ticket on the way home. And so the vaccine clearly caused that. Anything that happens after you get vaccinated, people are going to hyper focus on it. But that vaccine, getting a shot in the arm, he didn't even have time to develop a bronchitis. But first of all, there's no virus in it, and it's not going to have any effect on his lungs. But it was because it was the association, and she didn't know. And so after I talked to her about this, and we talked about the whole process, she got vaccinated. And you know, it's just one of those things like where I feel like if nothing else, if I can change the mind of one person to help them protect themselves, that's it. This call, it could be 50 people on this call, and if nobody takes the information and decides not to use it, as sad as that would make me, I have to be at peace with that, because I'm giving you accurate information from the horse's mouth. I'm coming straight from the place, and in giving you information that you can use to get vaccinated. If you decide not to, that's the beauty of this process. You don't have to. But I'm just hoping that on this side of it, that you can find something there that's true and use it to battle what you're seeing on Facebook and YouTube and some other places. I mean, I've made YouTube videos telling people how mRNA vaccines work, how vector vaccines work. And I had to put that out there to try to fight some of the misinformation that was out there, because it is a lot of it, man. A lot of it.
It's
So,
crazy.
but yeah, so you know, so just by you knowing more information, anybody on this call hearing information, just like you said, you got vaccinated. The point is that you share with somebody else, because somebody's watching you. You're an influencer to somebody. Somebody's watching you, and they're gonna say, man, well, Damon got vaccinated and he didn't have a car accident, and he ain't, you know, his head hadn't fallen off. So I'm gonna go ahead and I'm gonna get that vaccine too. And then they're gonna keep checking you now. They gonna keep calling you and checking, make sure your hair's still on. Your hair's still on.
Yeah, I know I probably can't cough around them or anything.
Hey, don't do anything negative. They're gonna be like, see, I told you. So yeah, no, but appreciate the question, man.
We have another call another question in the chat. Why is from Harold Rice? Why does Pfizer and Moderna use mRNA and J&J use a virus technology, unless I'm mistaken?
That's all
Some of that,
you.
I think, yeah, some of that I think is actually what the companies are used to in the past. So vector vaccines, or using the virus, the adenovirus to carry, is actually not, it's more common than even the mRNA technology. So I think Johnson & Johnson may even have other vaccines that have been along that line. So if they have that already set up, then they're going to naturally use that same method of vaccination and go forward. And it makes it easier. The thing is that in traditional vaccines, you have to use traditional vaccines like flu, you have to grow the virus and then weaken it, and then you add it to the vaccine. Now, in this case, with needing to vaccinate basically the world, but in the case of the US, 300 million people, you have to grow up a whole lot of virus. So that's why these technologies are so useful in a pandemic, because it would take a year by itself to grow up enough, probably 2 years, to grow up enough virus to then use for a traditional vaccine. But in this case, making a genetic sequence doesn't take very long at all. And that's why you can use these technologies. So really they're the same technology, they're just delivering it in a different way. Johnson & Johnson and AstraZeneca, they use the vector, they use a virus to carry it. And Pfizer and Moderna use the sequence wrapped in fat, which is nanoparticles, just fat. And that just helps it go into the cell easily. So that's really it. And I think it's because both of those companies had those platforms already ready, and they just used what they had.
Anyone else have any questions? I also would like, while you're thinking, if you have any questions, I would like to say that most of these people on here, you know, myself or one of the physicians, if you have questions, please, or you have someone that's doubtful, reach out to me. I can always, you know, ask the doctors, send you their response. If you know them personally, then you already have the connect. But let's try to debunk all of these myths. That's what this is for. It's meant to take this information back and spread it amongst the community. We're also recording it. So I'll put it out. Dr. Alozie will post it. I think Ian may post it as well. If you want it personally, just text me or contact me on Facebook if you don't have my number, and I will send you the link once it's edited. Okay. So
Okay.
we're here to help. We're here to do as much as we can, changing, the paradigm and the mindset of this vaccine and the virus. So feel free.
I mean, I think the
I
other
think-
thing to have a conversation about too, right, is, and again, we usually just think about ourselves or our immediate circles, right? One of the conversations about getting us vaccinated is what you don't want is a situation where you have these neighborhoods that are vaccinated fully and they don't got COVID. But then over here in your neighborhood in New Jack City, only 10% of the people got vaccinated. And so COVID keeps on popping up and people can't go to work and they can't get back to school. All the things that we really need to get vaccinated to do, right? I mean, again, I showed a thing on the screen just a second ago of where Israel, the United Kingdom, the United States all were in January. And guess what? We're still the only country that's up here. All the rest are down here, primarily because of vaccinations. I think that's something that sort of globally, people like Mr. Rice and others that are operating on a larger stage and can affect organizational policy really need to take into account to get the people that are around them to think it through. And I see the question that you're about to
Yeah,
refer
I was
to.
getting ready
I
to
mean,
say,
again, I think the thing is this, right? I don't know what Black Vegan TV is. I don't know whether it's a reputable news source or not. It might be, and so no aspersions of doubt on them. Again, I think let it play out. The VARS system hasn't picked it up. It wasn't talked about on the CDC FDA call yesterday. I listened in on almost all of it, and so highly unlikely all of somebody's skin fell off. Was it a piece of their skin? Was it the whole arm? Do they have a new arm like Bucky and Falcon and the Winter Soldier? I don't know. And I say that sort of to crack the joke, but also to say it's unlikely that somebody's skin fell off. But again, also remember, and this is very factual, because there is a link to J&J and some of these venous thrombosis, immune-mediated thrombocytopenia thrombosis phenomenon. I think anything that happens to somebody in terms of skin sloughing, pain, should be taken seriously. But again, the key take home here is report it to the VARS and let the VARS know about it so that they can call the person and investigate.
There is from Emily. Shirley, did that answer your question? I think we should maybe follow that later.
Yeah,
Okay.
I'm sorry. I was on mute. And I've not heard it, and that's not something J&J has reported. But I thought since I have some experts on the line, I might as well ask the question.
Yeah, absolutely.
I thought it was kind of, a moment, but you want to warm, and I'm trying to get people vaccinated as well. So when they hear these stories, it's like, so again, that's been reported. Please make sure that we take every side effect seriously, and it must be.
Shirley.
Thank you for your input.
Okay.
Thank you.
Shirley, you may want to type that in because I'm not sure, but you were robotic. So
You were breaking up a
you
bit.
were breaking up really bad. So just if you want to type that in, but Shirley actually works for J&J. So this was she texted me and said this was something that someone brought up to her and she just wants to be able to debunk it.
Yeah. So on that same note, we have to remember that just as much as we are, everybody on this call, or Mrs. James and us and Alozie, as much as we are trying to give you the right information, there are people out there who are literally generating false information. And it's just like going to Wikipedia to try to get information. Wikipedia is an open source site. somebody can go on and edit it and change information, and you have to remember that. And so I could, as a scientist, I could create a bunch. I mean, just thinking about like some of the things that people may or may not understand, I could create a bunch of things that would cast doubt that it's hard to disprove. But I'm trying to use that information for good and say, hey, let me make sure that people have factual information so they can make the right decision. So there's just as much crazy stuff going on out there, but I agree, and I think you should bring that stuff up if you think there are people who are going to fall victim to believing it. That's why I mentioned the HIV thing. There's a little bit of truth, and somebody takes it and they run with it. So I think it's important to make sure that we make those points and talk about those things, even if they are, not as believable as some might think. So I think it's important to talk about them all. But thank you for sharing that.
Emily O says, I saw an article that was talking about a double mutation variant. Can you debunk that?
No, and that's nothing to debunk. That actually is true. They are looking at some mutations that are, and when they call a double mutant, all it means is that there have been changes. And right now, I will be honest. So the virus itself, when we talk about the virus, we talk about the spike proteins. The spikes are the little projections that stick off. Those are the keys that help it get into your cell. So a lot of these viruses have multiple different, mutations in different parts of the virus. But the mutations that are important are the ones that are in those spike proteins, because those are the keys. So the key may make it easier for it to attach to your cell, and may make it easier for it to go into your cell. So that's where increased transmission comes from. And that's where we're concerned about. So some of them do have mutations. They might have, one of them in particular, I think they're worried about, has a mutation in the spike protein. It has 2 different mutations that actually make it more infectious. And so there is such thing as a double mutant. That's not a myth. But we're trying to figure out how much it is contributing to cases that are currently increasing right now across the country.
And I think there's something that should be also called out that people should remember. I mean, people don't know that, like Dr. Moore pointed out, because there's a double mutant doesn't mean it's more transmissible, right? And 80%, this was actually reported this week, 80% of the stories that are calling out the double mutant and the triple mutant, they're in virus strains that have no increased transmissibility. So they're just telling us what we knew last year. We knew that there were variants. We knew that there were double and triple mutants. We know that there are double and triple mutants in HIV and hepatitis C. And guess what? We have medications for those too. And I think it's really important. One of the takeaways from here is that as of today, on April 24th, 2021, every single vaccine that exists has been shown to have proven efficacy about all the variants of concern that exist today in the planet that we're aware of. Not just from an antibody standpoint, but something that people don't talk about because it's not easy is T cells. And that's why I'm a lot more bullish about these vaccines and plus or minus a 3rd dose than others. But T cells are the actual drivers of, are you protected? Antibodies just protect you today. T cells protect me a decade from now when I turn 60. Right. And so we know that the T cell levels of people that have been vaccinated and people that have gotten natural immunity from being infected previously, they continue to remain active and produce those T cells. Will we have people that fall out? Absolutely, because each of us is different. But I'm really bullish and excited. And so double variant, triple variant, I stole a term from Monica Gandhi of UCSF, variant, schmariant, scariant. I think, again, it's the clickbait of people trying to frighten people. Focus on the here and now. Let scientists like Dr. Moore figure out the future. You can't fix tomorrow if you can't fix today.
Exactly. And those T cells that Dr. Alozie is talking about are memory T cells. Those are, and they call them memory T cells for a reason, because it's like your immune system has 2 different weapons. It has what, as Dr. Alozie just eloquently just explained, you have antibodies that will respond today and coat everything and destroy the virus. And then you have the T cells, the memory T cells that hang around in your body for 2-3 years. And if you ever come into contact, their job is to remember. And okay. Then they go talk to the B cells, and the B cells produce more antibodies. So that's exactly what memory T cell is. And so I'm glad you pointed that out. So that's a unique thing about mRNA vaccines, is that they actually give you a very strong T cell memory response. So they don't talk about it a lot because we're talking about antibodies, we're talking about today, but the memory T cell response is really, really high with mRNA vaccines.
Yeah. And I think part of it is the memory T cells are what you can test, right? You can test easily. And when I say easily, it's the test that LabCorp and Quest can run. But in your lab at the NIH and a lot of research labs at UCSF and Harvard and Michigan and UT, they're not dealing with simple tests. They're dealing with tests that are actually going to define this pandemic 10 years from now. And so I think people need to remember that when the St. Louis News and the Michigan Gazette and the El Paso Times are talking about antibodies and T cells, they Googled it. They didn't ask Dr. Moore. And so always be careful about who is the writer and what is their background.
Right.
I just received a message via text from Banshee Booker. It was, is it true that you should drink a lot of water before and after the second vaccine, the second dose? Will it cut down your side effects? I guess maybe just talk to.
I'm about water all the
possibly,
time. Just
yeah,
always stay
water.
hydrated, right? You want to take like 64 ounces of water every day. But to preempt your question, Chastity, there's nothing that you're gonna do potentially from a water standpoint or a vitamin D or E or collagen or protein water that's gonna change your reaction to the vaccine. Each body reacts differently to the vaccine. If you want to take some Tylenol, take some Tylenol. But understand going in that a third of people have absolutely no side effect whatsoever. They don't feel the pain. They don't have fever, chills, nothing. And there's like another 5th or 20% of people that do. And there's everything in the middle. And so there's no thing that you can do that's magical. And this is not just about vaccine, but I think in health, there are very few things that you will do in your life that are going to protect you against life. Stay hydrated, eat good, get some sleep, pray, listen to music, life will be good. And everything else will figure itself out.
Another question I received was before the call was everyone else seems that they're getting reactions when they get their second dose, right? But this person they didn't have any reactions. So does that mean that their body didn't build the immunity? Should they be concerned that they're not protected because they didn't get fever, chills, body aches, or anything like that?
No, that actually goes right to what Dr. Alozie just explained. Everybody's going to respond slightly differently to a vaccine. And so first dose you get, so the typical, let me back up just a little bit. The vast majority of people above 60, 65 years of age don't really have any major side effects. It's usually the people that are in a bit younger group. My mother, same thing. I was actually concerned because I'm like, if I'm talking to her to get this vaccine, I'm like, watch, she's gonna have a response and she's gonna react and nothing. She got a shot. She didn't have any issues whatsoever. And so the reality is that the first myth is that an immune response or a reaction, side effect, quote unquote, a mild side effect is completely normal. And you actually should almost welcome a mild side effect because of the fact that it's just your body responding to the vaccine, point blank. The other part of it is that your first shot is your body's introduction to the vaccine. That's your body's first exposure. So just like somebody mentioned a little while ago, it's just like in allergies. If I was exposed to pollen last summer and had a really bad reaction to it, this next summer, my body's gonna respond differently because it has had a preview of what I'm going to be exposed to. So that's the same thing. Your first shot, your body gets it. You probably don't feel much at all. You have a sore shoulder. Second shot, now you have maybe low-grade fever, chills. I had exactly the same thing. Your body responded because it has second exposure, and you have had some antibodies that were developed in response to that. And so now your body gets exposed for the second time, and now you have a stronger response. Now, if you don't have an immune response, if you don't have any side effects, you don't have any chills, or it doesn't mean you're not having an immune response. People just respond differently. So don't take that as I didn't get the chills and fever, and I didn't feel a little off, so I didn't have an immune response. You still had an immune response. It's just that your body responds differently. And as I mentioned, a lot of people above 65 don't typically have any of the reported side effects that we've talked about commonly.
Okay. Does anyone else have any questions or, I mean, we've been at the barbershop a little while now, so just wondering if we've answered the people that have put questions into the chat or sent in questions prior to the conversation. Do you feel that your questions have been answered to your satisfaction? Do you feel confident leaving the chat? Do we need to expand on anything else? Speak now.
I would have said forever hold your peace, but I'm sure we'll do another one. So
Yeah, that's what I was gonna say.
Yeah.
I was
speak
gonna
now.
say it too.
Speak now until
Yeah.
the next round.
Yeah, I was gonna say speak now or hold it to the next conversation. Don't blow my phone up. If you were on this call, do not blow my phone up after we hang up. Now, I'm going to the beauty shop. No, I'm just kidding.
Yeah.
But no, really, just honestly, we just, we want to thank you all for your time. We want to thank Dr. Alozie, Dr. Moore, all of the participants, Ty, the YWCA of Chicago.
Baby cousin.
That's baby cousin. Ty is my baby cousin, you all. And we, but I just want to really thank you all for coming out. I see all of the wonderful comments. We will have this recorded. We will post it. But please pass the word on when we do it again. It seems like every time we plan this, something new is coming out. And so it's really valuable to the community. But it's just us trying to do it, So if you know people that can pass the information along and get more people on. The last time we had almost 100, about 100 people on. This time it was, I think, at max was like 40 something people. In December, we had about 50. Just because you're vaccinated, people still have questions. Join in, learn some more information so that you can go out there and have confident conversations with people from experts. Okay, so just, help us spread the word along and, don't get caught up in all of the weeds. Use the facts that you're learning here. And if you have any questions, just feel free to reach out to myself or the physicians.
All right.
Hey, I appreciate it. Thank you, everybody. Y'all have a great
Absolutely.
weekend. Until next time.
All right.
All right. Take
Thank
care.
you all.
Bye.